Dr. Salim Surani joins us live to discuss the latest on the COVID-19 pandemic. Dr. Surani, good morning once again. Thank you so much for being with us. How will a shortage affect the treatment and monitoring of COVID?
Good morning, Bobby. Glad to be here. This is a big challenge, especially when you're considering a disease which is mild in symptoms. The testing is very important. For example, if you have a disease which is very lethal, what happens is when you get the infection, you get very sick and you tend to go to and seek the healthcare much earlier, whether you're going to the emergency room, hospital, or the urgent care. But when your symptoms are very mild, then what happens is if the testing line is long or there is not availability of the testing, you kind of shrug those symptoms. You still continue to go to the grocery stores. You are still going to your work. You may be going to the school, and that is how the virus is spreading. So when the disease is very, very mild, the testing is very important, and the ease of testing is the key factor. Because if you are having a very mild symptom, or you have been exposed to somebody who is closer to you and you're not having any symptom, you don't want to stand in the line for 2, 3 hours or go to 5 Walgreens or CVS or some other places to find a test and spend the whole day in finding the test. So I think that is the reason when you have a mild variant, which is a very highly transmissible, the testing is the key factor and the ease of the testing is the importance of all.
Dr. Surani, how accurate are these at-home rapid tests?
Those are pretty accurate. It's more than 90-95% accurate. So I think depending on what kit you're using, but most of the time it's a good screening tool. And if there is any doubt or anything, sometimes you may have a negative test, what we call is a false negative test, and you're not having, if you're having a lot of symptoms, then you can always confirm it with the PCR or the rapid antigen or some other modality of the testing or repeating the testing. So there is a possibility of a small false negative test. But at the same time, as far as the screening tool is concerned, it's a great, easily accessible testing. Now, at least if we can get the home testing, that would be easier. In UK, it's so easily accessible everywhere, at least 4, 5, 6 months ago. And that is a surprising factor why, as the most developed country in the world, we lag so behind in the testing.
Do these tests detect Omicron?
One of the things is it's not important whether we detect the Omicron gene or not, because whether it's a Delta gene or Omicron gene or Beta gene, that is done on the genomic testing. What the test will tell if it is positive or not. And when it is positive, then based on the community transmission, when the Delta surge was going on and majority of those tests were positive for Delta, that is probably a Delta. But when the Omicron transmission in the community is high, more than likely you have Omicron. What the labs in the public hospitals or the county, what they do is they send the portion of their test to the CDC or some agency for the genomic testing, where they tend to determine what is your circulating genomic in your county. So from the public point of view, what you need to know if you're positive or not, that helps you to do is protect yourself and protects your friends and family from getting the virus and causing it a further transmission.
Dr. Surani, as always, thank you so much for spending your morning with us, and thank you so much for your time. We appreciate you. If you have a question for Dr. Surani, text the question to the number on your screen. That is 361-855-6397.